Thank you. Good evening. Welcome to the public hearing for the Human Services Block Grant for the upcoming fiscal year. We have several representatives of Human Services present today to talk about their various aspects within the department. The block grant, and we'll discuss this in a little bit, has been in effect since 2012, and we have for tonight for our discussion a review of where we've been through the past fiscal year and where we intend to go. So with that, I will turn it over to our Human Services Director, Ms. Angelique Hires.
Hello. The Human Service Mission Statement reads, Delaware County Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, culturally competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. And we also have a Human Service Racial Equity Statement. The Delaware County Department of Human Services acknowledges and understands historical and ongoing systematic racism exists in our work environment. Racialized practices and behaviors which result in disparities and inequities within our department will not be allowed to continue and must change. The department's goal is to create an organizational culture of inclusion and equitable success where the unique voices of all are valued, thereby bringing demonstrated diversity and creativity to our workplace and services provided. I'm going to pass it to Jessica Fink.
Good evening. Adult and Family Services Mission and Vision Statements. Adult and Family Services oversees a wide range of community services to families and adults in Delaware County. Our responsibilities include oversight of contracted services under the continuum of care for homeless programs including homeless prevention, emergency shelter, and permanent housing. Adult and Family Services also provides contractual oversight for food assistance, medical assistance, transportation, and a variety of other supportive services. Adult and Family Services supports agencies through ongoing education and the provision of tools to ensure equity in their services to assist families and adults in leading safe, healthy, and productive lives and break the cycle of homelessness. Families and adults will receive equitable, trauma-informed, and outcome-focused services from provider agencies. Drug and alcohol.
Hi, I'm Pam Bell. The Drug and Alcohol Mission and Vision Statements. The mission of the Delaware County Single County Authority is to assure the provision of a comprehensive array of quality alcohol and other drug services for eligible children and adults that will assist them to maximize their human potential. Who we are. The Office of Drug and Alcohol is an administrative office that oversees the delivery of treatment and prevention services in Delaware County. And what we do. The Division of Drug and Alcohol Programs provides funding for prevention, intervention, and treatment services to all eligible Delaware County children, adults, and families. And now for Janet Draitline.
The Intellectual and Developmental Disabilities Mission and Vision Statements. The mission of the Delaware County Office of Intellectual and Developmental Disabilities is to advance the health, welfare, rights, independence, and community inclusion of all children and adults with intellectual and developmental disabilities and/or autism spectrum disorder in Delaware County. We envision a community that includes people with intellectual and developmental disabilities and/or autism spectrum disorder as full members of the society who self-determine to the greatest extent possible, visualize fulfilling lives, and utilize natural and paid supports as necessary as part of a meaningful life. The Mental Health Mission and Vision. Delaware County Department of Human Services Mental Health Office's mission is to assure the provision of a comprehensive array of quality mental health services and supports for eligible adults and children that will assist participants in maximizing autonomy, independence, and self-determination. We do this by collaborating with as many families, adults, systems, and providers as possible to identify individuals who are in need of mental health services. We strive to educate all of our stakeholders and our system partners regarding the need for and the delivery of culturally competent, trauma-informed, and evidence-based services.
We're going to pass this to our Community Interactions and Human Services Chief Officer Sandra Garrison.
So the Human Services Block Grant, as I said earlier, was initiated in 2012 and 2013 with Act 80. Delaware County was among one of the first counties to agree to a request to be part of the block grant. We were accepted. The thing about the block grant that's really helped our county is in the past, if we received funding, say, for mental health, and we didn't use all those funds, they had to go back to the state. So we could possibly have money that's going back to the state in one categorical, say, mental health, but another, say, adult and family services, where we need the money, but we ran out because we didn't get the sufficient allocation based on our county's needs. The block grant allows us as a county to determine where the needs are, and this is part of that process, is engaging the community to see what the community's perception are on the needs, and making sure the funding goes where the needs are at the time. In past years, when the block grant was first initiated, we did not have sufficient funding for drug and alcohol to meet the needs, so there were times when we had to shut the system down because we couldn't serve all the individuals. The Human Services Development Fund, which is including this, the allocation was cut several times over several years prior to the block grant, so the services for the own house were impacted by that. But then we were sending money back in other categoricals because we were meeting the needs, but we had additional funding. So we were able, since the block grant was initiated, we were able to stop I didn't have to shut the drug and alcohol system down. When the Healthcare Act was passed and individuals were put on medical assistance because of the behavioral health or mental health or drug and alcohol needs, then that system was adequately funded, so we were able to shift some funds to the intellectual and developmental disability system, because at that time there was individuals in programming that needed additional support, so we were able to move funds to do that. So the flexibility of the block grant has been very beneficial to our county. With that, I'll turn it back over to Ms. Hires to talk about the planning team.
Our planning team is many of the members here, including Sandra Garrison, Chief of Human Services and Community Services. It's me, Angela Hires, Human Services Director. We have Gaston Gonzalez on the end. He's our Chief Financial Officer of Human Services. And to my left, Janet Draitline, our Mental Health IDD Administrator. Donna Holliday, Mental Health Deputy Administrator. Alicia Redden-Revelle, our OIDD Deputy Administrator. Pam Bell, to my right, is our Drug and Alcohol Administrator. And Dana Ranko, our Drug and Alcohol Assistant Administrator. We have Jessica Fink up front, and she's our Adult and Family Services Administrator. Samantha Strockbein, our Fiscal Officer 1 for Human Services. She's up front on our right as well. And we also have Vandy Moseray, a Fiscal Officer for Human Services. Warner Williams, Fiscal Officer 2 for Human Services. MH, IDD, and DNA Advisory Boards. Our stakeholders include the Children's Cabinet and Coalition, Mental Health and IDD Advisory Board, the DNA Planning Council, the Delaware County Advocacy and Resource Organization, NAMI, Voice and Vision, Partners for Success Coalition, Police Departments, Delaware County Treatment Court Teams, Delaware County Anti-Trafficking Coalitions, AFS, DNA, IDD, and Mental Health Providers, Community Support Program, ComPeer, the Homeless Services Coalition, Community Care Behavioral Health, Employment Forum, the Delco Collaborative, ODP and OMSAS Field Offices, the Springfield Cares Coalition, the OIDD Families and Participant Directed Services, District Justices, and Delaware County School Administrators. I'm going to pass it back to Sandra Garrison to talk about what we want to do.
Thank you. So again, the flexibility of the block grant has been very beneficial to our county. The other piece of the block grant that has been very beneficial and will continue to do so is the fact that we're allowed to retain a certain percentage of the funds. Currently, it's 5%. So 5% of the funding, if it's not used, we can retain to use in the upcoming year. We have supported things such as services for the on-house, for shelter programming. We have also had helped providers with recruiting and retaining staff more recently. With some of the closures of various programs throughout the county, we've been able to use these funds to assist new programs to take over the services where there was a void left from other providers that have left or have ceased providing services. So we have been able to do a lot of good things with the carryover funds, because as long as it's used for one of the purposes outlined in the block grant, one of the categoricals, we can retain the money up to 5%. So with that, I will turn it back to Ms. Hires to talk about our accomplishments.
We're proud of all the work we've done this last year, and for fiscal year 22-23, our accomplishments include successfully transitioned to a new behavioral health managed care organization known as CCDH. We have enhanced partnerships with the county criminal justice juvenile justice system in an effort to prioritize treatment and reduce incarceration and detention. We've partnered with community organizations to ensure county residents have equitable access to key programs and address barriers to services. We continued our Healthy Kids and Healthy Schools initiatives in conjunction with the District Attorney's Office. We also distributed and posted service maps of all human services programs. And our No Wrong Door activities have increased access to social determinants of health, like food, shelter, childcare, and treatment, with help to divert individuals from poverty, criminal justice system, and high levels of care by collaborating with various county offices, townships, boroughs, community partners, to provide an overview of human services programs and resources. I'm going to pass it to Jessica Fink to speak about the accomplishments for the last year for Adult and Family Services.
So Adult and Family Services had several accomplishments. We created a new partnership with Human Good to provide us 6 housing slots for the homeless population or the near homeless population for 62-year-old seniors at Grace Court. Breaking Bread Community and Upper Darby Shelter opened December 2022 to provide an overnight shelter to 17 single adults. 55 unduplicated individuals have received service. 15 of those were 61 years or older, so we're seeing an increase in our older population in shelters. And again, 55 unduplicated individuals were served December 21st, 2022 through June 30th of 23. We increased collaboration between the shelters and Project Share, which is across the street, to provide life skills groups and treatment services. St. Joe's Family Hope Center, formerly Family Promise, contracted with us to expand emergency shelter for families in Delaware County. Over a 2-year period, 46 emergency housing vouchers were distributed through Delaware County Housing Authority to domestic violence survivors, persons in shelter and rapid rehousing programs. The Delaware County Housing Authority provided 32 mainstream vouchers for homeless persons with disabilities verified by the Social Security Administration. We created a training committee comprised of COC providers and community stakeholders to develop a core training curriculum for all homeless services providers. And we had a successful application for Home for Good funds to provide furniture, rent assistance, SEPTA passes, and temporary emergency shelter. I'm going to pass it now to Pam Bell at Drug and Alcohol.
In drug and alcohol, we supported our provider, MVP Recovery LLC, as they expanded from offering recovery housing services and outpatient treatment to also offering level of care screening and assessment services, as well as certified recovery specialist warm handoff services. Their certified recovery specialist warm handoff services greatly expanded the number of community engagements of individuals accepting referrals into treatment for substance use disorder, in addition to continuing to offer these services in hospitals and emergency rooms. MVP Recovery LLC also implemented the Law Enforcement Treatment Initiative with single county authority support and funding, partnering with the District Attorney's Office and outreaching to many police departments in the county, who are key to allowing such a program to be successful. Since the inception, 83 individuals have completed treatment services through this program. Over 30 individuals have been housed successfully through the Finally Home program. The Finally Home program is designed to assist individuals with an opioid use disorder or stimulant use disorder stabilize their housing. The program provides assistance for up to 6 months of rent along with moving costs such as security deposit and moving costs. We also expanded the single county authority anchor providers by adding 2 additional sites with existing providers to now have 7 total anchor provider locations. The services there include screening and level of care assessment, and it's the first step to accessing treatment and supports for substance use disorders. It's green, can you hear me? Okay. The Office of Drug and Alcohol Prevention staff worked with contracted prevention providers to increase the strategic prevention framework plan and programming to add gender-affirming and culturally appropriate services, as well as increase training opportunities for staff and community parenting programs. A successful training series was also held with topics that included race and substance use, gender and substance use, poverty and substance use, and disabilities and substance use with a variety of qualified and informative speakers. We were also awarded a grant by the Pennsylvania Department of Drug and Alcohol Programs to establish a crisis stabilization center in Delaware County, which will provide access to screening and assessment, screening for mental health symptoms, coordination and referral to medication-assisted treatment, and engagement with certified recovery specialist services. We also, with the closure of a major hospital system within the county, did not have to halt services, but rather expanded our network and programming to other providers so residents would still have options for treatment and recovery support services. I will now turn it over to Janet Draitline.
For the Office of Intellectual and Developmental Disabilities, the accomplishments were that we were able to initiate a cross-system collaborative team to support individuals who are involved in multiple systems, recognized at the Everyday Life Ceremony for outreach and community engagement by the intake unit. We achieved the quality management goal of reducing restraints, and we also had independent monitoring for quality review of 180 individuals reported no immediate health and safety priority concerns. We added an incident management position, which allowed the office to complete 107 investigations and maintain compliance with the Office of Developmental Programs timelines. We conducted monthly trainings for new prospective providers to discuss life-sharing services. We enrolled individuals in life-sharing program and successfully supported the transition of individuals into the community from prison. For mental health, we developed Delco Contact to provide support to families while awaiting service capacity. We had the development of processes and go live for the multi-system youth pilot with Georgetown University and Stoneleigh Foundation. We became one of only 4 Pennsylvania counties to secure a 4-year system of care grant. And we were able to operationalize the mobile Crisis for Law Enforcement program through the Congressional Directive Spending awarded to Delaware County. The initiative involves coordination between Human Services, the District Attorney, Emergency Services, and local law enforcement. We secured a $2 million grant in the Community Hospital Integration Project program to develop a forensic center to support the diversion and step down from prison and a mobile restoration of competency program. Worked with our criminal justice partners to improve collaboration for those individuals who are re-entering the community. We worked with the Court and Community Connections Administrator and District Attorney's Office to move forward the Healthy Kids and Healthy Schools initiative. And we secured a grant for $250,000 from the Office of Mental Health and Substance Abuse Services to evaluate our county crisis services and bring them in line with the Substance Abuse and Mental Health Services Administration's Crisis Toolkit. And I will hand it back over to Ms. Hires.
Right, for fiscal year 23-24, our goals and initiatives for Human Services are to commence our transition from civil service, to increase our staff retention, and also to evaluate providers and programmatic policies on a comprehensive basis with a statistics, data, and quality unit to ensure decision-making is data-driven. We're planning to collaborate with executive leadership and quality teams to develop the first annual Department of Human Services Integrated Quality Improvement Work Plan and annual evaluation. We're going to expand the Department of Human Services internal quality management capacity for increasing quality staff with a focus on efficiency, increased data collection, and standardization of procedures. We're planning outreach hours, that our outreach hours will be increased in the community with county offices, libraries, community providers, by offering time for residents to learn more about our human services programs as well as be immediately linked to these programs. We're planning to research and develop enhanced forensic infrastructure to decrease recidivism and increase community tenure and access to social determinants of health, especially in the areas of transitional housing and programming for special populations. I'm going to pass it on to Jessica Fink.
Goals and initiatives for Adult and Family Services for the upcoming year are to identify and activate a new outreach team to provide new outreach services to unsheltered residents in Delaware County. Application for an expansion of our CE services to include a 24-hour access point. SHARE program is in the process of renovating a warehouse in Delaware County to be the first Delaware County food bank. The exploration of funding opportunities to bring back the SOAR program, which would assist homeless individuals with obtaining their Social Security benefits more expeditiously. Reduce the number of households who become homeless and reduce the length of time they remain homeless as compared to the previous year. Transition households from emergency shelter or rapid rehousing into permanent housing whenever possible. Reinstate shelter space to the pre-pandemic occupancy capacity. And increase and secure ongoing forensic funding so we can continue to provide bridge funding for housing, food, transportation, IDs, clothing, and other social determinants of health, which help to increase community tenure and well-being of those returning to the community from prison or a regional forensic center. And Pam Bell will tell us about drug and alcohol.
The SCA will continue working on transportation needs throughout the county and offer travel resources, including funding for rideshare apps that offer health options. We will promote SCA-funded services in a meaningful way so that residents and stakeholders see the SCA as a resource for prevention, treatment, and recovery support services, but also as a starting point to accessing help for substance use disorders. We will continue to enhance collaboration between various providers, stakeholders, and county offices, including the newly established health department. We will be hosting our in-county contracted treatment and prevention providers will meet for the first time together to collaborate on the needs of each other's programs in our first ever joint provider meeting. We are going to compile a list of all substance-free activities offered in Delaware County and make it accessible to the community. The Delaware County Single County Authority will coordinate and research instructional, recreational businesses, such as running, outdoor activities, music, schools, etc., who would offer lessons and classes at free or discounted rates for individuals in recovery. The Delaware County Single County Authority will coordinate and sponsor social wellness events, free of substance or gambling focus, through partnership with our contracted recovery house providers. These events include a softball tournament and outdoor hike at Ridley Creek State Park. The hike is partnering with a local animal rescue. Events are open to the community. In addition to these events, Delaware County SCA will have resource tables available with treatment, recovery, and prevention materials. The purpose of this initiative is to bring the recovery community together to help reduce stigma related to substance use disorders while addressing the lack of social and recreational alternatives in Delaware County. We will also continue to engage hospital and emergency room staff to increase utilization of the Single County Authority Certified Recovery Specialist Warm Handoff Program to serve individuals surviving overdoses and/or those with substance use disorders who present to the physical health system. In addition, the Single County Authority will continue to work with the newly contracted Certified Recovery Specialist Warm Handoff provider, who will be expanding these services exclusively in two of the five hospitals that serve Delaware County residents. I will now turn it over to Janet Drapeline.
The intellectual and developmental disabilities goals and initiatives are to continue to enhance multi-system cross-collaborative teams to review, plan, and coordinate levels of care for transitional age youth and adults, to share and provide opportunities to discuss the benefits of life sharing and supported living for individuals exploring residential supports, to provide opportunities for individuals to connect and with community partners in order to engage in meaningful day activities, supported and competitive employment, and community participants supports, explore data to review access and utilization of services as it relates to racial disparities, to continue to provide education and support individuals, families, school partners as they transition from education system to the adult program, to support individuals who have everyday life by utilizing tools from the Life Course framework, and to expand our current dual diagnosis treatment team to support our individuals living in the community. Our mental health goals and initiatives are to commence an assessment of crisis services and development of a plan to address service gaps and bring Delaware County's crisis services in line with the Substance Abuse and Mental Health Services Administration Crisis Toolkit, to open the Transitional Age Youth Residential Facility, to open the Forensic Long-Term Structured Residence, to open the On-Site Center and Base Service Unit on-site crisis center and base service unit on the eastern end of the county, to implement our Hair initiative, which works with our communities of color to raise both prevention awareness and the availability of services to assist our county work toward unique programming to equitably address the needs of all community members, to implement a warm handoff program in the emergency departments, to expand our dual diagnosis treatment team to provide additional supports to individuals with both mental health and intellectual and developmental disabilities, gain and maintain community tenure, to develop a forensic rehabilitation center to divert or step down individuals with multiple needs from entering the prison or remaining incarcerated, to develop a mobile competency restoration program to allow for competency restoration to happen where the person is as opposed to in a facility. And now I will pass it on to Gaston Gonzalez, who will talk about the fiscal impact of the block grant.
The fiscal year 23-24 Human Services Block Grant budget, it is estimated to be $50,229,572, and it's allocated through the various programs. Mental health, $38,912,248 will be account for 77% of the budget. Intellectual and developmental disabilities, $7,843,449, which account for 16% of the budget. Drug and alcohol will be $2,005,281, which account for 4% of the budget. Homeless assistance will be $957,997, which account for 2% of the budget, and the Human Services Development Fund, which account for $510,596, or 1% of the budget. And I will pass it to Sandra Garrison.
Thank you. So I hope through this presentation and what we've done as a county and what we'd like to do going forward, that it's clear that our commitment is to the
and NAMI co-facilitate the support group. So constantly hearing about people's needs.
And I'll start and I'll pass it off to the team for other responses, but I think probably the best central place is our website. It does have a lot of information. We are in the process of redoing it. Us
be able to do and what direction we feel that, we want to go with that advisory board. So if that's something, you said you just recently retired, if that's something you might be interested in, it's not a huge commitment, and that it's every day. It's like once every other month or once a month, kind of a thing. So that's just another way that you can kind of get connected to the county.
Yes, thank you so much.
Absolutely. And one other final thing, sorry, we keep saying that. But if, after looking at this, that you either don't see something or you have another question, there is the Human Services email, and it's on Delco HSA, I think Delco HSA, or,
I'm not sure exactly what it is.
Delco, yeah. But it's on our website, and I wish you'd know that, I apologize,
Just
but,
connect this through the main website. So
Right.
if you go through the main website, that's the easiest way to find us. And there's a link, but you can access any question and get any
Right.
kind of resources. We'll definitely connect you to whatever program it is and bring it all together and back to you for, whether it's for you or for a community member. So the easiest way is the primary website for the county. And
Yeah.
it links to everything.
Yes.
So you don't have to think about anything else.
Yes, thank you very much.
Thanks for
Thank you.
coming.
Are there any other questions or comments from anybody? Okay. We did receive one email online from Shirley Gallagher in Havertown, and she is a representative of NAMI, Delaware County, and she's representing not only a family member, but a chapter population of NAMI. I feel it is more important that all services for the mental health population of Delaware County be kept in place and/or added an overall improvement, especially access to mental health services and doctors. Public housing is another huge issue which must be better addressed. The dedicated mental health line by email, a lot of people complain they do not get responses quickly. Please note that this is an expression of great need for it strongly exists in our county. A couple, I guess, responses and comments. We have no intentions of ending services. We're looking to expand services. Unfortunately, as many of you have learned along with us over the past year or so, that we don't always have control of that. When we have a large provider within the county deciding they're not going to do the services anymore, we have to scramble and find solutions. With that, I just want to say that our provider network in this county has been phenomenal, whether or not, NAMI, our in-home providers, our residential providers have really done a great job of coming together and helping us fill the gaps, as have other providers that don't maybe currently work with the county. Have put forth a lot of efforts of coming in and filling those gaps in services. We know there's more that we need to fill. We know this is a huge need. With respect to housing services, the county, under Dr. Taylor's direction, did start a housing task force. We had several meetings of it and broke into several subgroups. One focused on the unhoused population, one focused on the rental market within the county and eviction, and then the other one focused on sustainable housing for low-income sustainable housing for folks. That is a work in progress. We also, on the Human Services and Housing Community Development side, and also Adult and Family Services under Human Services, got together with a consultant and did an assessment of all the current housing services we have. Through that, we met with individuals that receive services. We met with individuals that provide services. We met with the stakeholders across all the systems within the county, courts, and elected officials, and came back with some recommendations that we then dovetailed into the housing task force. Again, we just started the work. We're due to regroup in September. We have specific goals that we're looking to accomplish. We're now going to talk about the best way to accomplish those, realizing that, we had a list of maybe 10 things each group came up with, and okay, what are our top 2? And how do we accomplish those top 2? Realizing we still need to do the other 8, but what are the 2 most pressing at this point? And with that, I'll turn it over to, I guess, Janet, if you have any comments on the email.
For housing?
For the email.
Yes, we do work really hard to get those emails distributed, and we will look at how they're coming in, who they're coming to, and how they're getting distributed, and make sure that people are getting responses if they're not getting responses. That is something we can certainly address immediately.
Thank you.
Charlene, are there any other emails?
All right, thank you. With that, I just want to thank everybody for coming. For my final comments, I want to start by thanking our county council. Without them and their support, none of this could be happening. I think one of the things we've really been doing taking advanced strides in over the past couple of years is really collaborating within the county and leveraging some of the other offices within the county. I mean, you heard Ms. Drightline talk about the mobile crisis for law enforcement, which is an initiative not only with us, but we have the support of the local police department, and more importantly, have the support of our district attorney's office, who he's been very integral in getting that program up and running. We've worked with other court partners, we've worked with other elected partners as well. And obviously, the Human Services staff, you see some of them here. A huge, huge thank you to them and all their work. It's not easy like everybody else. We don't have a lot of staff. We're down staff in some cases, up to 50, 60% of our positions are vacant. But they still show up every day. They get the work done. Sometimes I don't know how we get it done, but we do get it done. So a huge thank you to not only my administrative team that's up here, but also to the people in the office of caseworkers that are doing the daily day-to-day work for our residents and the community members. I mean, obviously, we need input. We want to know where the services are lacking or what you guys are seeing on the ground. And with that, unless anybody else from here?
Just one comment, since we have an audience, we are having a job fair this week, and there are several positions open. So if you know anyone from the community who loves this work, wants to be involved, there's several opportunities. So please contact our office and we'll get you connected, because it's in all areas. So every department here, plus some you don't know about, are open. And we look for college grads, entry level, whoever wants to do this work and serve this community, because we want to do this together and we need the input of everyone involved. So thank you.
Thank you. And also just a thank you to our IT staff who has been here both times and helped us and get this broadcasted. So thank you. And with that, I